On July 9, 2025, after a 3-week trial, our clients secured a complete defense verdict for a cardiologist and his practice group in Cook County Circuit Court. The plaintiff asked the jury for up to $21 million. The jury deliberated for just 90 minutes. The case centered around a 65-year-old man scheduled to undergo elective umbilical hernia repair surgery. Months earlier, in January 2019, he had seen the defending doctor, a cardiologist, for severe hypertension. Medications were prescribed, and close follow-up was advised, but the patient never returned. Fast forward to June 2019. The patient was preparing for surgery, and the surgeon requested cardiac clearance. Our client provided clearance based on his prior evaluation, indicating the patient was at low to moderate cardiac risk. No repeat visit was scheduled. Plaintiff alleged that the cardiologist was negligent for not reassessing the patient in person and argued that his blood pressure remained dangerously uncontrolled. But blood pressure readings were often fluctuating, not acutely dangerous, and stabilized at key moments. On the day of surgery, there was a temporary drop in blood pressure during anesthesia. But as shown here, it rebounded quickly. The plaintiff claimed this drop caused a stroke, but the medical timeline tells a different story. Our defense highlighted that the patient showed no signs of stroke for nearly 2 hours after surgery. We assisted in educating the jury on the 3 primary stroke mechanisms. This was not a watershed stroke from hypotension. This was a classic atherothrombotic stroke, a blockage in the right middle cerebral artery, caused by an unpredictable embolism unrelated to anesthesia. The defense experts explained how plaque rupture leads to clot formation and vessel occlusion, even in stable or elevated blood pressure conditions. These events are spontaneous and often unpreventable. Watershed strokes occur when perfusion drops across boundary zones. Hemorrhagic strokes result from chronic hypertension and vessel rupture. But the patient's imaging showed a large vessel blockage, textbook atherothrombotic stroke, not caused by transient anesthesia-related blood pressure drops. We reinforced the timeline. Stroke symptoms appeared well after anesthesia had worn off, and PACU blood pressures were stable. The theory of causation collapsed under scrutiny. With compelling testimony, clean visuals, and a science-based narrative, the jury understood the truth. The cardiologist followed appropriate standards. The stroke, while tragic, was not preventable and not the result of negligence.